There are huge differences between medical care here in the United States and medical care in developing areas of the world.
The hospitals especially are very poorly equipped and very much in need of basic supplies.
I'd worked on a medical clinic where resources were very limited. Every day we would start our day with making our own gauze, making our own saline, using fishing line, literally fishing line to use as suture material.
At some of the remote hospitals we worked at, they repaired, vulcanized these gloves, re-sterilized it, and used it 3 or 4 times before they discarded it. And these are supposed to be disposable.
I've seen small children ages 9, 10, 11, 12 looking like they're 9 months pregnant, and that's not exaggerating.
Some of them will have far advanced cancers because they have not been able to obtain any kind of treatment for a long period of time.
The nearest facility could be 1,000 miles away, and you might as well be on the moon at that point because you have no car, you have no truck, there's not a bus that would take you, and if you could find access to care, you don't have the funds to allow you to go.
And what happens is they wait a long time to have their surgeries performed, and eventually some cases get quite a bit worse. And some of them won't survive because of the long wait.
If organizations like MedWish did not give us supplies, our efforts would be a disaster.
MedWish is a very important and very integral part of our mission project.
MedWish International is a nonprofit whose focus is to save lives and save the environment.
We saw a need, and we knew that there was our ability to fill that need, and we put those two concepts together.
Items that in the past have gone into landfills are now items that are improving lives in other parts of the world.
We have these supplies. We throw these supplies away every day because of regulations that are often placed in the United States hospitals. Let's no longer put those supplies into the local landfills and really make a major impact to the health care of those in need around the world.
Something as simple as a little 1-ounce pack of suture could save 2 lives at any given moment in time.
The scope of our humanitarian projects at MedWish are from the smallest, perhaps 10 pounds of suture, life-saving suture, to a 40-foot container that can be 20,000 pounds of life-saving supplies. Both of them are critically needed in other parts of the world. That small box represents perhaps hope for a mother to have a safe delivery, while that container may be furnishing an entire hospital, bringing them up to a standard that they can effectively and efficiently save lives.
We need people's help to support us as an organization. We need volunteers to help us sort through these supplies, whether you have a medical background or not.
This is probably the most pivotal time of MedWish. We have established long-term relationships with many countries, and in order to sustain those relationships, we need funding. We need your support to make a difference in the world.
If we did not have the supplies from MedWish, the children which we saw in November would surely not be alive today.